This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945. Hello, everyone, and welcome back to the Outcomes Rocket podcast. I'm excited because today we're diving into the real state of women's healthcare in 2025, why it's lagging, what's changing, and how we could fix it. I'm excited to introduce Kristine Cecchetti for today's episode. She's a women's health advocate, innovation driver, and a firm believer in the power of genuinely listening. With more than 20 years in the industry, she's driven to make healthcare better for women. And I'm excited to have her here on the podcast with us. Kristine, thanks so much for joining us.
Oh, thanks so much for having me, Saul. Great to be here.
It's such a pleasure. Look, we're dealing with a huge problem. To begin with, where does women's health stand today? Shouldn't we be past these challenges in 2025?
You know what? You would hope so. But the state of women's health today, it's just dismally fragmented. It's still under-researched, underfunded. It's really ready for a serious overhaul. You would think that we'd be ready for big change because it is 2025. But when we're talking about women's health, we're still talking about playing a little bit of a game of catch-up, given that we didn't start testing on women. We didn't bring women into clinical trials until the early 1990s. So all the research we've got, all the data we've got, it's really based on men, and that's only making up half our population.
It's definitely an area that requires focus, and at least we're hearing more of it. This next question is really like around beyond reproductive health. Has the definition of women's health evolved?
Yes. And thank goodness for that, because you're right. For so long, when we were talking about women's health, what we were really talking about was getting pregnant, delivering babies, menopause if we were lucky. But what we're now really discovering is that more than 60% of all conditions, of all disease, impact women disproportionately. So the story that we need to be telling goes well beyond reproductive health, everything from cardio-diabesity all the way through mental health.
Well, you know what? It's so important, and I'm so glad that it's broadened. Why do you think this broadening has occurred? Like, what are the forces behind it?
I think for starters, women are really more comfortable speaking up. I think also employers are playing a terrific part in this, and that they're really trying to, of course, be self-sufficient and attract the best talent, but they understand that a lot of their population is made up of women, and they really want to offer benefits that span the lifespan. Gone are the days when all you had to think about was, well, we offer maternity leave. Now there's a whole lot more happening in the game, and that's really great. That's terrific progress.
It's exciting, and it's exciting for leaders like you that have your mind on this problem and are pushing the agenda on a policy side at all the levels that we can. The problem, though, is beyond just clinicians. So why can't women just rely on their doctors?
Yeah, great call out. I think for so long, so many of us just understood that if you had a problem with your health, you could go depend on your doctor to help you fix it. And those days are really gone. So when I alluded earlier to having that lack of research, that doesn't just apply to women as customers, that also applies to our physicians. You don't go through all of that schooling and all of those grueling processes to not be able to truly help your patients. But they are at a disservice also because they've only been trained on male bodies. And listen, it's not easy to be a female-directed clinician. The reimbursement rates are lower. The legal risk is a little higher. It's tough. But the flip side of that is for women as consumers, they're really left advocating for themselves, far more so, I would argue, than what men need to do. And that advocating also really ends up meaning finding a provider who will truly listen to you and help you get to the bottom of the problems you're trying to solve.
Yeah, listen, I was just having this conversation with my wife. We're moving back to San Diego, and we used to live there. It took her maybe 2 years to find her like OBGYN, somebody that listens to her, somebody that understands. And it's super important. So I'm glad you mentioned that. And I think it's obvious, but I want to double click on this with you, Kristine. Why should everyone care about women's health?
Great call out, Saul. I love that. And really, that's because women's health is health for everyone. There you are mentioning your wife. I guarantee you know a plethora of other really important and significant female figures in your life. When you're talking about women's health, you're talking about supporting the health of everyone. And that is incredibly important. We want to be thinking about women not only from a employer perspective, right? How do we keep our employees healthy? But you want to be thinking about, this is my wife, this is my mom, this is my daughter, this is my sister. How do we really improve the health of women? Because that's improving the health of communities.
Love that. So well said, Kristine. Let's improve the health of our women. That is improving the health of our communities. I love that. And so today, you're in the business. What gives you hope?
Oh, yeah. So many great things. I was just talking about this with a friend, and it's like menopause being talked about in the Super Bowl. Breast cancer was talked about during the Super Bowl. We're really starting to expand the conversation, but so many cool things are happening in Femtech. And like I said, women's health is ripe for some serious overhaul and serious innovation. Everything from hemorrhaging, post labor and delivery to the wearables that you're seeing people come up with. It's really exciting to see some of that. And also, again, those employer-led benefits. So really embracing and understanding that to attract a strong population, you have to offer benefits that go the distance. We're really starting to see that, and that's exciting.
That's really exciting. And so let's acknowledge those wins. It's like this is a gap and gain, right? Let's be in the game in our thinking about this. At the same time, though, there's still some gaps. So what gaps do you want to call out here?
Whew, it's a long list, and we have a short amount of time today, but I'll tell you. You start with something like autoimmune. 80% of the cases of autoimmune, female. Migraines, very disproportionately impacting women. It's a very broad pool. Again, 60% of conditions and women more than men. But those are two of the big ones. But we're also seeing things like GI health. What can we do to improve the health of women there? It's just one of those topics that, yes, we are making these incremental changes. It's exciting to see, but we really do still have a long way to go.
Well said. And if you could wave your magic wand, Kristine, and change one thing tomorrow, what would it be?
Oh man, I'm going to cheat. I'm going to say two because number one, we need more sex specific research. Everybody who goes to medical school, you are getting sex specific training on everything from mental health, cardio-diabesity, you name it. That sex specific training, understanding how the female anatomy works because it is very separate from how men work. That would be number one. Number two, really encouraging women to take great care of themselves. I think, these conversations lately have had a lot to do with things like menopause and aging. But frankly, when you're young, your body's forgiving. But that starts to change really quickly as early as our 30s. That goes for men too. So understanding you need to really own your health. And when you own your health, then it puts you in the driver's seat. You understand when something feels off and you're not as quick to let that physician dismiss you when they're saying, you know what, this is part of getting older. This is okay. No, it's not. And women deserve better. But unfortunately, that means that they really do need to know themselves. They need to embrace what they can do in terms of taking care of themselves, their health mentally and physically, and then also advocating for themselves.
I love that, Kristine. That's a really great and inspiring kind of encouragement for everyone. Look, I love this conversation. I think we'll probably end up doing a part two. But to close out, I want to close out with maybe a call to action to two specific groups. Number one, your message to women. And number two, what would you say to the CEOs and policymakers making a difference in the space?
Great call out for women. Again, you are your own best advocate. Stand up for yourself and advocate like you would for your kids. We see women just go to extraordinary measures when you're taking care of your kids. Take care of yourself the same way, just as important. Those kids need you and they need you to be healthy and strong. For employers, this is a very specific call to action. This is no longer niche. This is generating, it's strategies, it's income, it's all of those things. Your female population needs you, and so does the rest of the world.
I love that. Kristine, I would typically say drop the mic, but do not drop the mic. Keep the mic in your hand. keep keep preaching this very important topic. I'm so glad you were able to join us and really discuss this very important topic. If people want to reach out to you and learn more about what you're up to, how can they do that?
Absolutely. Please find me on LinkedIn. These are topics I absolutely love talking about. And again, there's so many things happening so quickly. And it's really an exciting space to be in. So I always love new connections.
Outstanding, Kristine. Ladies and gentlemen, thanks for tuning in to another episode of the Outcomes Rocket on this very important topic of women's health. It deserves more than just lip service. It deserves action. So share this episode with your friends if it resonated with you. Let's keep the conversation going because that's how we make the difference. Thank you all for tuning in. And Kristine, thank you so much for joining us.
Thank you, Saul. Take great care.
This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.